WHO declares global health emergency as Mpox outbreak surge in Africa. The World Health Organization WHO has declared the rapid spread of Mpox across Africa a global health emergency, cautioning that the virus could extend beyond the continent's borders. This declaration follows a meeting of WHO's Emergency Committee and comes shortly after the Africa Centers for Disease Control and Prevention, Africa CDC, issued its own public health emergency declaration. Mpox, formerly known as monkeypox, has led to over 14,000 cases and 524 deaths in Africa this year, surpassing last year's figures. The Democratic Republic of Congo accounts for over 96% of these cases and deaths. A new, potentially more transmissible form of the virus has emerged in Congo, raising alarms among scientists. What is Mpox? Mpox is a virus related to smallpox, first identified in monkeys in 1958. Until recently, most human cases were reported in Central and West Africa, often linked to contact with infected animals. In 2022, Mpox began spreading globally, including through sexual transmission, with outbreaks reported in over 70 countries. The virus typically causes mild symptoms such as fever, chills, and body aches, but can lead to more serious complications, including lesions on the face, hands, chest, and genitals. Rising concern in Africa. The number of Mpox cases in Africa has surged dramatically, with the Africa CDC reporting a 160% increase in cases and a 19% rise in deaths compared to the same period last year. The virus has now spread to at least African countries, with new outbreaks identified in Burundi, Kenya, Rwanda, and Uganda. These outbreaks are linked to the epidemic in Congo. A new form of Mpox, identified in a Congolese mining town, appears to be more transmissible and deadlier, with a mortality rate of up to 10%. Unlike previous outbreaks, which typically caused lesions on the chest, hands, and feet, this strain results in milder symptoms and genital lesions, making it harder to detect and increasing the risk of unknowingly spreading the virus. Meanwhile, Ivory Coast and South Africa are dealing with outbreaks of a different, less dangerous form of Mpox that spread globally in 2022. Implications of the emergency declaration. The WHO's emergency declaration aims to mobilize international resources and attention to combat the escalating Mpox crisis in Africa. However, past global responses to similar declarations have been inconsistent. Dr. Jean Kaseya, Director General of the Africa CDC, emphasized the need for swift and decisive action, calling on international partners for assistance. He noted that current control strategies are insufficient and more resources are urgently required.